Now, the pandemic continues to take its toll on the nation's mental health, with new data suggesting it's contributing to a worsening situation for young mums.
The Murdoch Children's Research Institute says as many as a third are experiencing significant mental health problems and ongoing fatigue, as well as high levels of parenting stress. A lot going on. Professor Stephanie Brown has been involved in the study and she joins us now. Professor Brown, good morning to you.
Thank you.
Gee, a lot of the mums you spoke to have been dealing with a lot, haven't they?
They definitely have. The study that we're talking about was done in the first year of the pandemic here in Melbourne and Victoria. So we got a really good read on what was happening in that second lockdown. And as you said, there was increasing fatigue, irritability, sadness, anxiety, really spiked in that first big experience of being at home and managing remote schooling. And then we saw things settle down a bit as we came out of lockdown, but mental health didn't go back to pre-pandemic levels. So as well as looking at things like fatigue and anxiety, we also looked at clinically significant depression and anxiety, and that went right up as well and also stayed up beyond the period of the immediate lockdown.
Were these women experiencing, everything from fatigue to depression? Were they seeking support? Obviously, we know that there were limitations and barriers to going out, speaking to your psychologist and your doctor as you normally would.
Yes, we've heard a lot about that, and our data certainly reinforces that. Only about half of the women that were experiencing clinically significant depression and anxiety had sought help from health professionals, a GP or a psychologist commonly. The other half hadn't, and what we could see was that women were tending to prioritise support for their teenage children, because all of these mothers actually had teenage children, over and above their own mental health and well-being. Young people's mental health really deteriorated in the pandemic, and that was a family priority.
You made a very important point there, because the mums tended to bear the brunt of remote learning. Challenging for the students, of course, but terribly taxing for these mainly women who had to oversee that. So that must have had a significant role on deterioration in mental health.
Absolutely, and we also saw that women were stepping out of the workforce, either reducing their hours or stepping out of the workforce altogether in order to manage that caring responsibility that they had for their children. That was undoubtedly having an impact on the family finances and also on mental health as well. So you see that parenting stress go up, conflict in the family going up as well, all of which would have been affecting the children and, of course, their parents as well.
Yeah. There's so many factors at play here, everything from the financial stress to the additional burden of making sure that your children are coping okay with remote learning. Was that what the data was showing you? It was, I guess, a layered experience?
Definitely a layered experience, and I think the important thing for us was that it really highlighted the gaps in our service infrastructure. This is a cohort of women and their firstborn children that we've been tracking since the women were pregnant with that first child. So we've seen their interaction with health services over time. In the early years, in Victoria and across the nation, we have a really well-developed infrastructure for supporting families, children and their parents. But as children grow up, we don't really have an infrastructure that holds the whole family. We have an infrastructure that focuses on young people. We have our standard primary care services, but we don't have a way of thinking about how we hold the health of the whole family. And what our data really showed us was all these things are interacting, and perhaps an unequal burden of caring responsibility on women to the detriment of their mental health, and a lack of infrastructure to really pick that up and support them.
Professor Brown, really appreciate you coming in and telling us about it. Thank you.
Thank you.
Thank you very much.